Here we go. So, like I said, my name is Katie. Thank you for joining me this morning. We're going to talk through some things to do with caesarean section. So, what to expect, and we will just briefly talk about, what an elective is, what an emergency is, because those are the two types of caesarean section. Like I said, if you have any questions, feel free to pop them into the chat or just drop me an email. That's absolutely fine. And that's also the same, later on, if you have any questions later on today, tomorrow, next week, you are more than welcome to drop me an email and ask any questions that we might have. So like I said, we're going to talk through some caesarean section stuff. The idea, hopefully today, is that we'll give you a bit more of an understanding of what a caesarean section is, learn the differences between elective and emergency caesarean sections, sort of know how to prepare, what happens on the day, what to expect, and then have a little look around recovery, emotional well-being, pelvic floor, and a bit about like your breathing techniques, comfort measures, just to give you some ideas as well. And hopefully it will help to alleviate any sort of anxieties. And that really is the aim of antenatal education, to give you some information so you can make good informed choices for yourselves. Everything in maternity is your choice. Okay, now as a healthcare professional, we are here to advise you guys. Ultimately, everything is your choice. We won't even touch you without your permission, contrary to what you might see out there, especially on social media. We would strongly urge you to step away from things like TikTok and Instagram, where we know people are posting different things about maternity, pregnancy, labour, birth, and what happens postnatally, and information even with regards to infants. These people are not regulated. Please make sure that if you are getting information, you're sourcing it from reputable companies or sources. Healthcare professionals, they are the people that are going to give you with the gold star standard information that is actually safe for you and for your baby, and relevant as well. So in Coventry, then, we have around 6,000 births a year, so that is a lot of births. We have sort of the largest numbers really in the area within the West Midlands, alongside Heartlands over in Birmingham. We are a level 3 unit, so we're very fortunate to have a level 3 neonatal unit. So what that means is we take all of the premature cases, like the severely premature cases. We take a lot of complex cases nationally, so people will travel from out of area to our hospital for care, specialised care, and then actually deliver their babies with us. And then we have our lovely, also just normal deliveries, normal ladies who live locally, who choose to, again, birth their babies with us at UHCW. But we know it can be quite a scary place to be sometimes. It can be quite an intimidating place to be. I myself have 3 children. I had 2 of them, in Coventry, and I had one over in a different unit. And even like being staff, I still found it really like sort of intimidating, anxiety inducing coming into the hospital. I remember feeling very much like, is everything going to be okay? Is my baby going to be okay? Is this going to be embarrassing? What's going to happen to me? Is it going to hurt? Like, these things are normal things that go through your head when you enter the maternity department. And we want you to feel at ease. We want you to feel comfortable coming into the department, and we want you to recognize the area with the different areas, sorry, within the department. So we just want to show you around using the virtual tour. Idea then again is, hopefully when you come in, you recognize the different areas, so you feel a bit more comfortable, you feel a bit more familiar, and you feel a little bit more relaxed. So first video of the day is the virtual tour. Here we go. There we go. So that is our department, and hopefully that's already familiar to you. But if you haven't been to the other areas within the department, say for example the antenatal ward, the postnatal ward, then hopefully that's a little introduction to you. So you kind of recognise it now when you come up to the wards themselves. Okay, so what is a caesarean section then? You know, what are we here to talk about? So a caesarean section is basically a surgical intervention or operation to deliver a baby or babies if you're having a multiple pregnancy. Okay, it's when the baby is born through the abdomen and the uterus. So there are incisions made from on the outer side from the skin, and then down through different layers, which then come to the uterus, and then the baby is then extracted from the uterus. Sounds very technical, let's say, but it's a surgical intervention. Okay, it is quite common. Caesarean sections are quite common, and contrary to popular belief, they are also safe. Okay, they are performed by highly skilled and trained surgeons who go through extensive training to be able to do caesarean sections. And we're really fortunate at Coventry to have a great team of obstetricians and doctors who support us as midwives, and then also you guys too. And they are the people who perform caesarean sections. I mentioned I've had 2 of mine at Coventry. All 3 of my babies were born by a caesarean section. So I can speak from experience when I say that they really are brilliant, and you would be well looked after. So there are 2 different types of caesarean section, as I've mentioned already. So we have elective caesarean sections, and then we have emergency caesarean sections. So an elective caesarean section is basically a pre-planned caesarean section. It's planned in advance, so you will know that you're coming in. You'll know the date you need to come in, you know the time that you need to come in, and essentially you'll know the day that your baby is going to be born. Now, just to point out and just to make you aware that if you have a elective caesarean section and you come in on that morning, just be mindful, okay? Because sometimes, depending on what's going on, it might be that it's a very busy day, the department's very busy, understaffed, whatever. Sometimes, not regularly, it doesn't happen too often, but sometimes they get cancelled on the day. So yes, we will give you a planned date to come in, but sometimes for various reasons they have to be cancelled on the day, just to make you aware of that one. But hopefully everything's fine and goes ahead. You have that set date, and then you come in and you have your baby. Usually, if you're having a pre-planned caesarean section, your date will be given to you around 36, 37 weeks of pregnancy. They like to perform a pre-planned caesarean section slightly just before your due date, usually around a week or so before your due date. And that's to reduce the risk of you going into labour naturally. And also, we have to make sure that you're over 37 weeks of pregnancy for a healthy pregnancy, because your baby is classed as term. So they wouldn't do it prior to 37 weeks of pregnancy unless there was other predisposing factors. Say, for example, if you were suffering with like preeclampsia or something like that, which changes things up. For a healthy pregnancy, a healthy baby, caesarean section, for whatever reason, a pre-planned one would be done after 37 weeks of pregnancy, but before 40 weeks, okay? An emergency caesarean section is when you require that caesarean section whilst you are in labour, or sometimes in small cases, actually, women come in antenatally and they are taken for an emergency caesarean section. Again, these are like women who suffer with things like preeclampsia and other obstetric emergencies or complications. Usually emergency caesarean sections, the majority of them are done when women are already in labour. Okay, so just to point out the difference between those 2 as well. Okay, sometimes they are urgent, which would usually be the antenatal ones, and the non-urgent ones, they're categorised. Okay, so they have category 1, category 2, category 3. Okay, category 1 is the most urgent. Category 2 is when we're urgent but we can wait, we're not too urgent, and a category 3 would be classed as kind of like it can wait but we need to do it. Okay, so sort of if you were being induced, for example, and that induction of labour had failed on our part, not your part, it might be that actually then the next option would be caesarean section. Cases like that would be classed as a class, can't say it now, 3rd class. 3rd class, is that the right word? Category 3. Yeah, you know what I mean. Yeah, I can't speak. So they're the difference between the 2 types of caesarean section, elective and emergency. So if labour does happen though before a planned section. So I said, you know, between 37 and usually 39 weeks they like it to be booked in for. But say it happens, you've got a date booked in 39 weeks and you go into labour at 38 weeks. What happens? Okay, so we would obviously advise you to come into the hospital, okay, where we will see you and we will assess you. We do a general assessment, which is what we would do for everybody else anyway. But obviously we want to speed it up a little bit because if you are in labour, we want to intervene depending on why you're having a pre-planned caesarean section. But basically it will be sort of a set of observations, so your blood pressure, your temperature. We always want a urine sample so we can dip that, and a monitoring of the baby. We want to see what's going on with you. We want to make sure your baby is also coping well, and we will assess you to see how you are contracting, how often you are contracting, and how strong those contractions are. Okay, sometimes it might be that we say, okay, we can hold off for a minute, but we are in labour. It might be that we need to do a vaginal examination just to confirm dilation, see if your cervix is dilating, and see how far along in the birthing process you already are naturally. Okay, sometimes we can adapt that plan then. So dependent again why you're having an elective or pre-planned caesarean section, it might be that they say, well, do you know what, you're in labour now, so if you want to continue in labour, it is safe to do so. Or it might be that, no, we're not happy to do so, let's just go straight to theatre. Okay, again, dependent on why you're having that pre-planned section. Say, for example, you are having a section because you had one previously, but everything else has been fine in this pregnancy, but that's literally the only risk factor. And you went into labour, they might say, like, you know, actually, do you want to try and have a vaginal delivery, or would you prefer to go for caesarean section? And again, this is your choice. You know, it's a conversation that you'll have with the doctors upon review. When you are in the hospital, you're being monitored, you've been assessed, and we come to a conclusion that works for you guys and for us as well. Ultimately, like I said, it is your choice. But that's essentially what would happen. We would weigh up what's going on, assess to see what's happening, why you're having that pre-planned caesarean section, and what are your options. Okay, and then ultimately you make that decision. So preparing for an elective caesarean section, what do we do prior to that? So we do something called a pre-op appointment. So you'll be given a date, you'll get a letter usually in the post to come in a little bit, maybe a week or so before your actual planned caesarean section, where we will do a variety of different tests and procedures and assessments, okay? Basically, we're building up a file, a clinical background of information that we will then use on the day, a profile, if you will, okay? So we will obtain some bloods from yourself. We're looking at like your blood levels, your blood red blood cell count to see why your blood clots, your blood group, that sort of stuff. These are for just in case if you were to hemorrhage, say for example, in theatre, and we needed to give you some blood to support you, we know exactly what blood to reach for. It's for safety reasons. We would take the blood samples, okay? Obviously, we will sit with you. We explain to you what we're doing, why we're doing it, and we'll ask for your consent, okay? We will give you in some instructions with regards to eating and drinking. So on the day or the day before, the night before your caesarean section, when you come in for a planned section, you need to basically have an empty stomach. So we will give you some medication usually, or they might say, do you know what, don't eat after 10 p.m. this day, but you're allowed to sip water until the moment we go into theatre. That tends to be the instructions, but we will give you written instructions as well. Okay, so you'll know exactly what you need to do on the lead up to your caesarean section, exactly what to do the night before, and then the morning of, we will give you instructions and make sure that you have those in your hands and you're ready to go. And again, you can ask any questions on the day when you come in for that pre-op. And we will ask you to pack your hospital bag. So make sure you've got your hospital bag sorted. I've got a slide that's going to give you some tips and tricks of what to pack in a second. But yeah, make sure that's all ready to go prior to your caesarean section. Really, you can actually pack it whenever you want. It's never too early to start packing your hospital bag. It's always good just to have that ready to go. Keep the most important things or sort of chronological order that you might need them in. Say, for example, if you know you're having an elective caesarean section, what I would recommend is getting like baby's first outfit ready and putting them in Ziploc bags, like sandwich bags, so you know, and label them. I don't want to be disrespectful to our dads, but sometimes they get a bit confused of what they need to get out. So if you've got everything packed and ready to go, labelled, you know what, first outfit, going home outfit with your vest, your baby grow, your mittens, your hat, everything in there, a nappy, everything in there, then it's literally a case of grabbing a sandwich bag or a Ziploc bag with everything in it, and then taking it to theatre with us. Or when you're on the postnatal ward after you've had your baby, it's easy for dad to get that out, or even for yourselves to get that out. You know, you've got it all there organised and ready to go. During the pre-op assessment, we also will take a few different swabs. We're swabbing for MRSA, which is it's a skin condition or infection, okay, which can actually hinder wound healing. We have to test everybody for MRSA who is coming in into our theatre environment, and they are a couple of self swabs. So we will give you the swabs to do yourself. It's like nose, armpit, groin, I believe. There's 5 different swabs. Again, we will advise you what you need to do. If you want to do them yourselves, then you can. If you want us to do them, then we can. And again, this is something that we do at the pre-op, so then we have the results ready for the day, for D-Day, okay? Now, on the day of caesarean section, we will ask you to come to the hospital bright and early, usually around 7:30 in the morning. Again, you will have a letter with instructions of what to do and where to go. But essentially, you come to the hospital in the morning, tends to be when we're having our shift changeover. And usually we ask you to come to the antenatal clinic reception area, okay? There you will meet a midwife. There's actually 2 midwives that work in elective caesarean section theatres, and they take it in turns. So one will go in with the first one, and then whilst we then transfer the first lady and her baby up to the postnatal ward, the second caesarean section is getting ready to go in, so that midwife, the second midwife, will then assist her. So there's usually 2, but you will be assigned one of the midwives. We will introduce ourselves, and we will take you around to a clinic room, where we will do observations, okay? So we're going to take your blood pressure, your heart rate, your temperature, all of those things all over again for our paperwork, and then the theatre team will then start to trickle in and introduce themselves. So you will meet the surgeon in the morning, or the surgeons. You will meet the anaesthetist, who will be there to keep you comfortable and keep you safe during your surgery, and it might even be that you meet the theatre team, depending on what's going on that day. So you will meet a variety of different people who will be with you in theatre for your caesarean section prior to actually going in there. Okay, I think that's quite nice. And again, they will be there to answer any questions that you might have. They will check your understanding of what's going on, and they will make sure that you've signed all the consent forms ready to go. Now, the anaesthetist will also discuss with you their pain relief options. So when you have caesarean section, you will be offered and administered an injection into your back. So you will be basically numb from the waist down. You won't feel anything. It takes around 4 to 6 hours after you've had that for it to wear off. So it's a quite a long-standing sort of, not long-standing, like it doesn't wear off too quickly. It follows you through. It's a very good pain relief option. But depending on what the anaesthetist thinks is most appropriate for you, depends on whether they choose to go for a spinal or an epidural. A spinal is a one-time injection. An epidural is when they leave a catheter tubing in your back. You still won't be able to feel anything, but they're just slightly different. It might be that the anaesthetist actually would like to have a look at your back prior to coming into theatre, so they can make that assessment, and they will then advise you as appropriate what they believe would be the most effective pain relief option for you. And again, this is a conversation for you to have with them if you have any questions with regards to the spinal or epidural anaesthetic. When you're in theatre, they also will take care of things like your blood pressure. They will give you antibiotics through a line. They will put the cannula in, so the little tube that goes into your hand to administer medication and fluids and stuff like that. They are in charge of all of that stuff. They will also keep an eye on your observations, your blood pressure, making sure that you remain stable and comfortable throughout the surgical intervention there. Now, when you are in theatre, and you're all ready to go on the table, so you've had your anaesthetic, you're lying on the table, we've got you all comfortable, your birthing partner can be with you. So you can have one birthing partner with you in theatre, okay? And they can stay with you throughout the whole process. So the moment you enter theatre, they can be with you. To the moment you go upstairs, they can be with you the whole time, okay? It might be that we ask them to step out for 5 minutes whilst we transfer you from the operating table into a hospital bed. Then we take you round to recovery. Sometimes they might ask your birthing partner just to step out, just because it's quite a busy environment. But in those instances, we would ask your birthing partner to wait in recovery, and then as soon as you are there in the bed, sat up, comfortable, we will wheel you through to recovery, and then you're reunited there together, okay? But once the operation starts, the baby is usually born pretty quickly, within a few minutes actually. People are quite often amazed that how quick it is. Yeah, quite quickly. It takes longer for them to actually suture afterwards, to put you all back together afterwards, than it does for a baby to actually be born. So it's quite reassuring that once you're in there, you know, baby's born quite quickly, and then you get them, you know, down your gown if you want them to, a bit of skin to skin contact if you want to, depending obviously whether you feel comfortable and you feel happy to do so, and also then just checking that your baby is also healthy, transition nicely, and they are also then healthy enough to do things like skin to skin contact. But if you don't want to do things like skin to skin in theatre, you know, we can actually move you around to recovery, sit you up, and then commence it there. But other things that we can do to create a positive experience, because it is a positive experience. It doesn't have to be a big scary thing. It is a positive experience. We can play some calming music, or just music in general. So just like on Labour Ward and Lucina, we do actually have stereos, and they all have Spotify on them. So if there's a specific song you would like your baby to be born to, then absolutely just let us know and we can do that for you. If you want to listen to a podcast or an audiobook, or there's a playlist or something like that, just let us know and we can sort that out for you. That's absolutely fine. As I've said, you can have your partner present or a birthing partner with you. And as I said, they can sit with you throughout the whole spinal. A few years ago, they would be asked to wait outside, and then once you were ready to go, spinal in, everything sorted, literally as we were about to start, we would get your birthing partner in. But actually, we recognise that women, they need their birthing partners there throughout the whole thing, and actually to ask them, the birthing partner, to wait outside whilst you're having, say, like a spinal situated, that's not good enough. So your partners are now welcome to come and stay with you throughout the whole duration of your cesarean section. But as I've already mentioned, skin to skin contact. And then we do try to adapt a gentle or family-centered approach. So it is very much about you guys. You know, we are there to support you, and cesarean section obviously requires a bit more of an intervention, but ultimately it is all about you guys. So, you know, what you say goes, and we will do our best to make sure that you do feel supported, you feel comfortable, and you are happy with your cesarean section. That is the ultimate goal, for you to go home, you feel happy, confident, empowered with regards to the cesarean section and the choices that you were able to make during. Okay. Now in theatre, what might you feel? We do get asked quite a lot. What does it feel like? So you won't feel any pain. That spinal or epidural, the anaesthetic there, will take away any pain at all. Sometimes you might feel a little bit of tugging or pulling. It's like a really strange sensation. I used to say to my friends who had cesarean sections after I had mine, it was almost like somebody was doing the washing up in my stomach. It was really, really weird, but it wasn't unpleasant. It was just a bit of a strange sensation, but it absolutely in no way, shape or form was uncomfortable or painful. It was a little bit weird, but it wasn't painful at all, okay? You most likely will feel a bit of pressure, especially as baby is being born, okay? Because the surgeons will, you know, obviously lift baby out of the uterus, out of the womb, which can be a bit of a strange pressure. Again, it's not painful, and as I've already said, baby is born quite quickly, okay? So even though you might be sort of being pulled around a little bit, a bit of tugging, you know, it is over very quickly. And then, like I said, baby's born, and then as soon as little one's born, they clamp and cut the cord after 1 minute, and then we will bring baby round to you, and the surgeons will immediately start to clean you up and start to suture the area, ready for transfer, okay? So what does it kind of look like in there? This is kind of, you know, a little bit of a representation of what theatre looks like. So it does look pretty busy, doesn't it? Well, the people at the very end of the table, you can see in the picture there, they are the theatre staff. They're like your ODPs and stuff like that. They are there to basically run theatre. They will shout things out, they will write things on boards, they will pass instruments to the surgeons, and they will check with us and you guys regularly, is everything okay? Is there anything we can do for you? They are there to assist, and they are there to run the theatre. It is their domain. They are incredible, but a lot of the time they do spend their time down the very bottom of the bed there. So even though it looks quite busy, you probably won't notice them there that much, because actually they're sort of, their job's sort of on the other side of the theatre, but they will obviously be there and be present. It is a major operation, as I said. You know, we need to be mindful when we are talking and thinking about cesarean section. I have had comments before, especially after my first one. I remember I had a comment, oh, so you took the easy way out. I was horrified at that comment, because there's nothing easy about cesarean section. Yes, in the moment, you know, you're not birthing baby, but the recovery afterwards, and actually the daunting prospect of being on that theatre table, on the operating table, you know, awake, it is very daunting. So there's nothing easy about this. It is a major operation, and it's not something that we do just for fun. Okay, it's really important that people are aware. You know, yes, cesarean section rates, they definitely are going up, especially elective cesarean section rates. But there's no we shouldn't take that lightly. We should not take that for granted. Actually, the impact this has on our bodies. But ultimately, it is to save your life or your baby's life. So, you know, when it's deemed necessary, it is the best way to deliver a baby if needed. Okay, but it is a major operation. As I said, one birthing partner can stay with you. The midwife who's cared for you during labour. So for an emergency cesarean section, the midwife who's cared for you during labour, we will go with you to theatre. So it will be the same midwife. We will just nip out for 5 minutes to get changed into a lovely pair of blue scrubs, and then we will likely then just pop up and reappear in theatre. Obviously make ourselves known that we're back in theatre to you, and then we sort of just linger around. We wait to for the surgeon to pass us the baby after birth, and then we will bring the baby around to you, introduce you to your little one. And then, like I said, if we want to commence skin-to-skin contact, or you want to wait, that's absolutely fine. If dad wants to have skin-to-skin contact, that's fine. If you want to wait until we go around to recovery, that's fine. We will do our checks for baby. I'll talk to you in a second about those. And that's it, really. Yeah, we're just there to make sure that everyone is okay, feel supported, and just offer a helping hand if we're needed. Now, usually it's one night in hospital, even with cesarean section, and then you can go home the next day. It's amazing, isn't it, really? But as with any operation, there are always risks involved there. So the risks for cesarean section include infection, blood clots, damage to nearby areas, especially like your bladder. When you're pregnant, your bladder is very close to your uterus. Pain, and then bleeding as well, as with, like I said, any operation. But your team are all there, okay? So the two people here at the front, those are your two surgeons. Like I said, you will have met them. If you are having a pre-planned section, you will have met them in the morning. If you have an emergency cesarean section, you still will have met them. They're the same doctors who do emergency cesarean section, that we have on labour ward. So the doctors will have been into the room, spoken to you, you'd have given you consent, then they would have gone out, then they would get changed into their sterile equipment there. So they look a bit different because they are all gowned up, gloved up, and got a mask on, but they are the same doctors that you will have seen. The anaesthetist is here on the left-hand side, and your birthing partner will be asked to sit on your right-hand side next to your head. That's sort of the setup. Now, the cesarean section wounds or scars are around 10 centimetres in length. So again, they're not the biggest, which I think is quite nice to understand, or quite good for you to hear. And they are really low down, below the pubic bone, below the pubic line. They start off initially quite red, a little bit purple sometimes, a bit ragged. They can be quite raw looking, a bit irritated looking, and it can be a little bit scary when you first see them. But over time, they will soften, they will flatten, they will sort of lighten in colour, and as the skin heals, they will become more like a scar that you would expect, like a silvery scar that you might have on your body elsewhere. Okay. Sometimes it can take a little bit of time for women to come to terms with having cesarean section scars. It's just about being kind to yourself, giving it time to heal, giving your body time to heal. It can actually take up to a year for your body to heal from a cesarean section, not the skin, but internally, because they go through multiple layers when performing cesarean section. So again, it's just about being mindful, you know, and the emotions that come with that can also be a little bit of a whirlwind. So good communication with us, good communication with your partners or your families, and like I said, giving it some time, being gentle on yourself, being kind to yourself. And if you do find that you are struggling with anything, you know, if it's painful, if you're struggling with the body image side of things, anything, you just reach out and we can support you with that. So after your baby is born, we treat you just kind of almost as if you didn't have cesarean section, so the same sort of stuff really. We always will do baby checks. And so the baby checks are there to ensure that your baby has transitioned smoothly from intrauterine life to ex-uterine life. So what we do is we look at their colour, their tone, have they cried, like are they handling as a normal baby should? Or are they blue? Are they floppy? Are they pale in colour? Are they're not reacting as we would expect them to? And do we need to do anything to support them? As I've already said multiple times, we do encourage skin-to-skin contact. It will help your baby to calm down after birth. It will help them to stay nice and warm. It will help to encourage and promote breastfeeding. The hormones that you need to breastfeed, kickstart the breastfeeding, all occur when you are in skin-to-skin contact with your baby. It will help to kickstart that. Oxytocin release in both mum and baby, helps with early baby brain development. Skin to skin contact really is amazing, and all you have to do is give your baby a cuddle and the baby will benefit from it, not just now, but actually the benefits even later on in life, from having early skin to skin contact. You know, like I said, they are lifelong, so it's incredible. And then feeding support as well. So we have a feeding infant specialist midwife, and she has her own team. They are based on Ward 25, which is the postnatal ward, and they will come and sit with you when you are on the ward to observe or assist with the feed to make sure you feel comfortable with breastfeeding. Now, cesarean sections can halter, is that the right word? Breastfeeding, or can affect the breast milk production. It can slow it down a little bit. Okay, so we would still encourage skin to skin contact, putting baby to the breast if you choose to breastfeed regularly, but just bear in mind, because the it's all to do with your hormones and all like those chemical release and all that stuff, which kickstarts the breastfeeding. Sometimes when you have cesarean section, we sort of skip over a little bit of like our body's natural processes and programming when you are in labour, which will kickstart that the breastfeeding hormones. So what we would recommend is having that skin to skin contact, especially because it's going to, again, hopefully help to fire up those breastfeeding hormones, which they might still be sleeping after cesarean section because your body hasn't gone through the physiological changes of labour and birth to say, hey, my baby's been born now it's time to start feeding. We actually skip that when you have cesarean section, because your body isn't going through that natural physiological process. So again, skin to skin is definitely going to be encouraged for cesarean section ladies to help kickstart that that natural process that your body will go through physiologically after you've had a baby to support feeding and breastfeeding. Okay, that's a very long-winded way of explaining that, but hopefully that's made some sense. So if you are struggling with the feeding though, do let us know. Even when you go home, if you struggle with feeding when you go home, we do work closely with the Coventry Infant Feeding Team, who we can refer to, or you can even self-refer to, and they will come and sit with you at home and actually help you with the feeding. It's, again, they are NHS funded, so it's all free. So please, you know, breastfeeding is one of the most natural things in the world, but it also can be really difficult. So it's about understanding that, try not to put too much pressure on yourselves, seek help when you need it, and recognizing where the signposting is. Okay, let us help you if you think that you need extra support with that. So Ward 25. So after you've been in recovery then, and we're happy that everything's looking good, we're ready to roll, we would take you upstairs to Ward 25. Now we have our own lifts from Labour Ward, which are actually directly outside of theatre, directly upstairs to the antenatal ward. At the end of the antenatal ward is our postnatal ward, Ward 25. So it's a private lift. We don't go through the main hospital. Okay, so it's private. Ward 25 consists of 6 bays. A bay is basically a large room. And in that room, there are 4 beds in there. The beds are then separated by some curtains, so that's your privacy. Those 4 beds also will share a bathroom on the bay, and the bathroom is just for our new mums, okay? Dads and birthing partners will need to use the facilities off of the ward, and when you arrive on the ward, we will orientate you to the ward anyway, so everyone will know what the rules are and where the facilities all are. Okay, so you'll be aware of that when you're admitted onto the ward. We also have 6 side rooms. A side room is a private room with an ensuite, and those rooms are dished out or allocated based on clinical need. Okay, so for example, if we are expecting our families to have a longer stay with us for any reason, it might be that we recommend a side room for obvious comfortability reasons. But just because we do allocate a side room doesn't mean necessarily that you're going to be in there the whole time. If somebody comes through our department that needs that room more than you, and it's deemed that they need that room more than you, it might be that we have to ask you to come out and go into a bay if we need to. So again, just being mindful of that one. And if that is the case, please don't shout at us. We are doing our best. We want everyone to feel comfortable, but sometimes, unfortunately, we do have to ask people to move out of the side rooms if somebody else needs that room a bit more than you do. And then we have family rooms as well. We have 4 family rooms, and those rooms are situated slightly off of the ward. They are large ensuite rooms again, and we keep those families rooms free for those who may be separated from their baby. It could be, for example, your little one might be in the neonatal unit, they may have been transferred out to a different unit, and then our bereaved families as well. It's just not appropriate for those families to be on the wards with the parents who have got their babies in the cots next to them. So that's what we keep those family rooms free for. Okay. So I mentioned what to bring with you. What will you need on the ward? So this is a list of general things that we think would be useful for you to bring onto the ward. You will have access to a double plug socket behind the bed space. You will have access to a small like drawer locker thing, but there are no locks, like actual locks on there. So everything is open. So we would urge you to please not bring any valuables into the hospital or to the department. If you do so, they are left at your own risk. We would ask you to please make sure you are bringing in any smart device chargers. So your phone charger, if you've got a tablet or something like that, bring in your chargers. We don't have any surplus on the ward that we can actually lend you out. So you need to make sure you're bringing those in with you if you're planning on using smart devices or anything that needs charging, like a Kindle or anything like that, that's fine, but bring in your chargers. We also would ask you actually bring in some headphones if you've got some as well. It's just about being considerate. If you are in a bay and you're using like a smart device, say you're watching a film on a tablet, right? And it's 2 a.m, you can't sleep, watching a film, and that's blaring out. The other 3 women are going to be disturbed, aren't they? So if you can use headphones where possible or where convenient, that would be great. Just to, we've had complaints before of women who have been disturbed in the daytime as well as the nighttime. So just be mindful, being considerate, like I said, of the other people in the bay. Bring in some headphones, I think would save quite a lot. And then if you are not sure what you're going to do with regards to feeding, whether you're going to bottle feed or breastfeed, or if you know you're going to bottle feed, please make sure you are bringing in pre-made formula. Ideally, we want you to bring in the starter packs. A starter pack is basically like a 4-pack of small bottles of formula milk. Okay, they're around 70 ml, I think, per bottle, and they come with pre-sterilized, individually packaged teats as well. So essentially, what you do is you remove the teat and place that screw that onto the bottle, and then feed the baby directly from the bottle. We can warm the milk up if you want to. We do have a milk kitchen. Again, we will orientate you to that when you arrive on the ward. But that's what a startup bottle of milk is. Some people were bringing in like the big bottles of pre-made formula, like the 200 ml bottles, the 500 ml bottles, the litre bottles. When a bottle of pre-made formula is open, it needs to be consumed within 1 hour. If it's not consumed within the hour, it needs to go into the fridge. Otherwise, it needs to be in the bin. We don't have the facilities, the fridge space in the hospital, in the wards, to actually refrigerate that milk, which means it has to go in the bin. And that is a lot of waste. People become quite upset about it. They get annoyed about it, and we get it. Times are hard. You're having a brand new baby. It's expensive enough as it is. The last thing you want is having to throw £10 worth of milk in the bin, barely used. It is frustrating for parents. So please bring in the starter pack. It's going to hopefully help to cause less tension, let's say, on the ward, and again, it just helps with the economy as well, and it helps to reduce the waste. Okay, so a starter pack, and you can get them down any baby aisle in any supermarket, and lots of different brands. It's about doing the research and making your own mind up as to which brand you choose. Should you choose to do artificially feeding or mixed feeding, or if you're not quite sure, that's what we would recommend. And then if you were taking your baby home in the car, and the majority of people do, please make sure you are bringing in a car seat for your baby with the newborn insert, like the one in the picture. It's actually illegal for you to take your baby home on your lap, okay? We will not allow you to take your baby home without a car seat if you're going in the car, okay? So please make sure you have a car seat. I would strongly advise practicing how to strap a doll or a teddy, something like that, into the car seat now, whilst we are still pregnant, so you get to grips with it. Because after you've had your baby, well, even after you've had a baby, after a few weeks, those harnesses can be an absolute nightmare. They can be a complete minefield. When you're sleep deprived, you've just given birth. If you've had a cesarean section, you'll be in a bit of pain, afterwards, the following day especially. Trying to tackle the car seat, it can just become too much. Okay, so try to alleviate a bit of stress. Try to help yourselves a little bit. Practice how to strap a baby a teddy, a toy, something like that into the car seat, so you know sort of what you're doing. And also how to strap the car seat into the car. We kind of forget we have to do that as well. Yeah, make sure that your partners know, or your birthing partners know, how to do that. For yourselves, ladies, you will not be able to carry the baby in the car seat. That will be too heavy for you after cesarean section. You're not allowed to pick up anything heavier than your baby itself after you've had section. So to carry a baby in a car seat is a big no-no. Your birthing partners or your partner, whoever is with you, they need to carry the baby to the car in the car seat, okay? So make sure they know that. Make sure they are able-bodied to do that. and they're prepared to strap the car seat into the car as well. Make sure they are well rehearsed with that too, okay? That's it really with regards to what you will need on the ward. Yeah, like I said, you will have access to, I didn't tell you that, did I? You will have access to 3 meals a day. Why haven't I didn't mention this, did I? No. You will have access to 3 meals a day, sorry. Breakfast, lunch and dinner, as you can see on the screen there. And then there will also a trolley that you can have access to 24 hours a day. And there's hot drinks on there, there's cold drinks on there, there are biscuit slices, there are cake slices, and there's fruit on there as well. So fill your boots. You're welcome to fill your boots with those things. But for your birthing partners, like I said at the beginning, we don't provide food for the birthing partners and we don't provide beds for the birthing partners. So just to make you aware of that, okay? Now, one birthing partner, as I said, can stay with you on the ward. For everybody else, we offer 1 hour, okay, visiting time in the evening between 7 and 8 p.m. And that's to help reduce the traffic through the ward. After you've had a baby, you will want to rest. So we're going to take the awkwardness out of it so you guys don't have to tell your visitors, I don't want any visitors, just say just between 7 and 8 p.m. And actually, if you don't want any visitors, you know, you don't have to allow people onto the ward. Just let us know, okay? If you have other children, they are welcome to come and visit you as long as they are accompanied by an adult. But other children will not be permitted onto the ward. So if you do have friends and family coming to see you and they bring their kids with them, we will ask them to wait outside on the in the corridors. They'll have to take it in turns because we don't allow other children. It's not the most appropriate environment to have kids running around. It can get really loud, it can get really hot, it can get really stuffy. And again, it's just about being considerate of everybody else on the ward as well, okay? So that's that. So after the surgery then, what would we recommend with regards to recovery? So as I've already told you, we will do monitoring, extensive monitoring in the recovery room, okay? So after we come out of theatre, we go through to a room next door. That is recovery, where we hook you up to some machines. We will check your observations every 15 minutes, document them, make sure you are comfortable. We will check your bleeding situation, and we will take handover from one of the nurses or ODPs that have been in theatre as well. We will, as I said, offer you pain relief. You will have the effects of the spinal or epidural for 4 to 6 hours afterwards, as I've said. And then once that wears off, we will give you oral medication that will be prescribed by the doctors after surgery and to help keep you comfortable, okay? We would encourage you to move and get up as soon as you are able to. It will help to aid recovery, and it will help with the pain as well. If you can get up and move around when you feel your legs again, when you get I can't think of the word now, when you can when you regain use of your legs, that's the word. When you regain use of your legs, we would encourage you to get up with the help of us, especially that first time, and we'll get you moving around. It's going to help reduce the risk of blood clots because we're going to help the blood to start to circulate a bit better. Keeping mobile does help you to not become too stiff, which in turn will then help with the pain, okay? And yeah, just getting your body moving around again. As soon as we come after birth. Obviously, you take it easy, but when you feel ready to get up, walk around, we will support you. And then the same goes when you're at home. Yes, we would encourage you to rest when you get home, but we also would encourage you to try and get up at least once an hour to move around, stretch your legs, get your blood moving, you know, regain a bit of independence, and hopefully that will help to aid your recovery. Now, thinking about, I've literally just said this, but I'm going to just show you this one again. Pain relief and moving around, exactly the same. Take pain relief regularly, gentle movement, everybody spoke about this, and ask for help, yeah. So, pelvic floor. If you don't know what the pelvic floor is, it's basically a hammock-like sort of muscle structure that supports your internal organs, okay? Everybody has a pelvic floor, even men do. And it's really important that we train our pelvic floor to help to reduce the risk of incontinence and help to reduce the risk of prolapse, okay? 2 big risks, especially after having a baby, are those 2 things, and we can help reduce that risk by strengthening our pelvic floor muscles and just general pelvic health as well. We have a pelvic health team in the hospital specifically for maternity. We're really lucky. We're one of the only units in the country that do actually have this. And they provide a service that will support women who are struggling with their pelvic health. So I'm going to show you a video they've asked me to show you how to, with regards of how to do your pelvic floor exercises and why it's important. But if you do notice or any of these things do ring true to you, just speak to your caregiver. We can make those referrals that are necessary for you, both antenatally and postnatally. And they basically would invite you in as an outpatient and go through sort of like a rehabilitation program, basically, to help you strengthen your pelvic floor muscles. Ideally, we would like you to be doing these pelvic floor exercises prior to pregnancy, but we know that that's not always the case. So please let this be a reminder to start them if you haven't already. And then when you feel ready to do so after you've had your baby, absolutely try to at the earliest convenience, again, to help reduce that risk of incontinence, both urinal and fecal, and prolapse as well. Okay, here's our next video. And if you are interested in hearing any more about pelvic health and the services that we offer in the hospital, if you check out our Facebook page, which is Maternity Services at UHCW, we do regularly post information and including their website, which is relatively new, like I said, but has loads of information. And they also hold webinars to support women and men, actually, to be honest, with regards to pelvic health and how we can support them with that. So interesting information there. And worthwhile as well. So, wound care, what would we recommend? So, we always would ask you to recommend to keep the wound as clean and dry as possible. Now, sometimes that can actually be a bit tricky, and we understand that. What we would say is if you're having a shower, let the water just run down your body. Don't put anything directly on it, okay? Just leave it alone. Let the water run down the body. That will clean it enough. When you come out of the shower, we'll ask you to pat it down dry, okay? Then, if you can, have a bit of a lie down. Lift your tummy up if you have a bit of an apron after a cesarean section. That's quite normal. If you don't, that's fine. But if you do, lift your tummy up to expose the wound itself and let the air get to it for a minimum of 10 minutes a day if you can. Okay, if you can do more, even better. But trying to let the air get to it will really help with the wound healing. Okay, again, trying to keep it as clean and dry as possible. Now, obviously, I don't know when your babies are due, but obviously it's really warm at the minute, and it's going to be warm for the next couple of weeks, and obviously we're getting into the summer, so hopefully it'll be warm for the rest of the summer. But if you are struggling to keep it like sort of sweat free, even, you can use a sanitary pad or a sterile towel, like ones you can get from the pharmacy, like the dressings, and actually put that against the wound if you feel that you need to. But within around 5 days or so, the skin should heal together. It should actually knit together. So then it will just be the internal stitches that are taking a bit more time to heal. But if you can, keep the area as clean and dry as you can. It is normal to experience some tenderness for a while after, for some months after. And also it's normal to experience some numbness as well, because when they perform a cesarean section, they also cut through nerve endings or nerves. It takes a little bit of time for those nerves to knit back together and for you to regain sensitivity in the area. And for some women, they never will. My youngest is 3 and I still can't feel around where the incision site was. You get used to it, but there's also that just to factor in as well. Now, if you notice any signs of infection or you're just not quite sure about it, always seek help. Don't wait and watch and see what happens. We would actively encourage you to seek help sooner rather than later, because a cesarean section wound, as you know, is quite extensive. It's not a superficial cut. It does extend a good few layers deep. So we want to make sure that we are, aiding that wound recovery and healing, and also supporting your body. If you do find that it looks like it might be becoming a little bit irritated, it might start to ooze a little bit, it might even start to have pus or something, anything like swelling, redness around the area. These are all signs of infection. Get it checked out as soon as possible. Ideally by a GP, or coming into triage and seeing a doctor if you think you need to. Okay, like I said, always give us a call and let us know. Now, when you go home, you might need some extra support. Like I said, you won't be able to or be advised to pick up anything heavier than your baby. So we want you to be able to rest, okay? Avoid heavy lifting, get some extra help if you need it, okay? For some women we have in the hospital, they don't have a partner, they might be going home on their own with their baby, and it might be that they have a friend or a sibling or the mum come and stay with them for a little bit. If you have people around you that are offering to do things for you, absolutely accept that help. Absolutely accept that help. And actually, if you do have a really good support system around you anyway, and you've got people coming to visit you, I would tax them. Yeah, you can come in, bring a meal with you. You can come in, but do my dishes for me. People, they do want to help. So let them help. Don't be embarrassed or ashamed. You've had major surgery and you're caring for a newborn. What other department in the world in healthcare do you have major surgery and then you're expected to go home and look after a baby as well? There's not another one. So take the help as it comes and as it's offered. And just also bear in mind, the recovery takes time. It's not linear. And it's not the same for everybody. So please try not to compare yourself to other people. This is really off topic, but I saw a post on Instagram, was it last week? Yeah, of Molly May. I don't know if you know Molly May and her partner Tommy Fury. They were like Love Islanders, weren't they? She was an influencer and he's a boxer. Tyson Fury's brother. Anyway, he had a boxing match, didn't he, event at the weekend, and she turned up wearing this like skin tight white dress, and everyone was like, oh my gosh, look at her. That's not normal, okay? That's amazing. She looked incredible, and hats off to her. But if you're sat at home in your pajamas with a Chinese spilled down your top, just surviving, not thriving, surviving, that's okay. Don't compare yourself to other people. We're not coming around to your house as midwives expecting your house to be spick and span and you to be like your hair done and everything. I would be worried if I came to come and see you that first day after you've been discharged home, and I'm not having to come upstairs to your bedroom, and there's not like mugs and stuff around your bed. That is normal, okay? Please don't compare yourself. Recovery takes time. It isn't linear. Some days you'll have good days, some days you won't have not such good days. It's just about recognizing when you're not having those good days, relying and leaning on the support that hopefully is offered to you and the support around you, and just taking your time. You know, postpartum is a whirlwind, and everybody experiences it slightly differently. And like I said, no pregnancy is the same, and no postpartum period is the same either. Okay, so just please bear that in mind. If you do find that you are struggling though, please do reach out, let us know, because we can signpost you and get you the support that you need. Okay, as I've said, mixed emotions here, they're common. Support is available. Talk to the midwife, speak to the GP, speak to your friends, speak to your family, get the support that you need if you find that you are struggling. Okay, so a few key messages then. We've finished early. A few key messages. Caesarean section, it can be positive. It doesn't have to be this big scary thing at all. Preparation, it definitely builds confidence. Knowledge is power. Please don't let this be the only information you get with regards to caesarean section. Like I said, go and do some research. Use this as like a building block, like a foundations to, you know, get an understanding about caesarean sections and what that looks like, what might happen, but go and do more reading about it. Support is always available. We are there 24 hours a day, 7 days a week in the hospital. You know, when you go home, we will give you a discharge pack. In the discharge pack has got loads of information with regards to what happens postnatally, and there's also a list of telephone numbers. If you need us, we are there for you. You're never going to be a burden. You're never going to be asking us silly questions. We much would rather you ask us what you deem to be a silly question than sit at home and stress out about something that you think sounds silly, but actually you're not quite sure about. Just ask us, okay? We are there to support you, and we will be there to support you. Now, I just want to show you or introduce you to the Real Birth Company just quickly before we end. The Real Birth Company are a company that we've worked with for a good few years now. They basically provide the families who are booked with us at UHCW an online antenatal education package. What that means is they basically compiled information, created a program that you can access from any smart device, whenever you want, wherever you want, for as long as you want, for free. We have paid for the package, so you guys don't have to. Really, really good. And we're really fortunate at UHCW because not every hospital has this. So this is an extra layer of antenatal education that we would urge you to look at. What you do is essentially you scan the QR code. If you're on your phone now, then if you go onto the UHCW Maternity Services website, go to the parent education tab in the menu, and there is a hyperlink that you can click on your phone. It will take you directly to the registration page. You just put your details in there. It will take you then to a dashboard. You then input your details in the dashboard to personalise the programme. Say, for example, you suffer with gestational diabetes. I always use that as an example because I had that with all three of mine. You click on that tab and it will then populate information and draw information about gestational diabetes and weave that through the programme where it's appropriate. Okay, so it is personalised to you and your pregnancy. Like I said, you can then access this programme whenever you want, for as long as you want. In the middle of the night, if you just fancy reading a bit about caesarean section, or you just fancy reading a bit about induction of labour or infant feeding or how the body works during labour, you can do that. That's absolutely fine. That's what it's there for. You can come and go as much as you please, and it's free. You know, why wouldn't you use it? Also, if English is not your first language, it is also translatable into lots of different languages. There is a selection of languages you can translate it or have it translated into, and that is actually human to human translation, so you know it's like legit. Yeah, it's not AI, it's all been done properly. So like I said, scan the QR code now or check out the website on the parent education tab, and there is a hyperlink that you can then click directly on your phone and it will take you directly to the registration page. So we've come to an end of our caesarean section workshop. I hope that's given you some information that you found useful. Like I said, if you do have any questions, you're more than welcome to drop me an email if you don't want to ask me right now. There is my email address there on the screen. I know you've already got it anyway, but just in case. If you are interested in joining any of our other antenatal classes, including an infant feeding classes, so feeding, breastfeeding, specific classes that are led by our lead infant feeding midwife, her name is Jazz. They are also can be found on our Eventbrite. We have virtual first aid classes, we have just general antenatal classes, we have a water birth workshop as well. So you are able and allowed to, I would encourage you to book onto anything that you wish to do. Again, this is all NHS, so it's all free to you because, again, you are booked with us at UHCW. If you don't have any questions, you are free to go. I wish you the very best. We look forward to welcoming you into our hospital, and I promise you will be very well looked after. But as I said, any questions at all, please do let me know. But if not, then yeah, good luck, guys. Congratulations, and I wish you all the best. You're more than welcome, Cara. Thank you so much for listening. Bye.